Thank you for your attention today. I'm Michael Barton, Director of Emergency Management for Calhoun County. We've got some important information that all the people in Calhoun County need to be aware of today. It's important for us to pay attention to what's going on in our community, and today we've got some of our leaders that are going to provide that update for each of us of the status of COVID in our community. Over the last several months, the stakeholders of this county have worked very hard to prepare for the worst, and we're working hard for the best outcomes in COVID in this community. Now we are in the midst of experiencing a surge that we had hoped would not come, but it is here, and we're diligently working through that at this time. Right now in the county, there is a cumulative case number of 814 positive cases to date. If we continue at this rate, we will see over 1,000 cases before the week's end. We have seen 430 cases in just the last 14 days. This is alarming. This means that transmission is high within Calhoun County. With over 430 cases in the last 14 days, that means we've got over 400 active cases right now in this county. This matters because it is affecting the lives of people and those around them. As we hear in a minute from our hospital officials here at RMC, we will see how the use of ventilators and the staff are in much need. We are at an all-time high in reaching our capacity. Some of our individual first responders are becoming exposed and are having to take appropriate precautions to be cleared before they can return to duty. Some local governments are seeing disruptions in the services that they can provide and as the way they interact with the citizens. Industry and business have been affected for some time and continue to be. Now it's time for each person to take action. Each of us can respond and take appropriate precautions to affect the outcome in Calhoun County. Today on each side of me are representatives from those leaders in our community of public health, the hospital, fire, EMS, and our law enforcement partners. Each of these groups are very much on the front lines in response to COVID in our community. In addition to taking care of the citizens that call for help every day, they also have to take care of our first responders, our healthcare workers, who are not only being affected by it, but infected as well. At this time, we'll start hearing from our leaders, and I'm going to ask Mary Gomillion, the District Administrator of the Health Department, to start first. Mary?
Thank you. We continue to see an increase in cases, which is requiring us to assist local partners with resources. We're continuing to have to investigate a number of restaurant complaints, other complaints around social distancing in businesses and other organizations. We would just want to stress to you how important it is to wear face coverings, how important it is to practice those social distancing requirements that we've talked about all through, ongoing since March. We're seeing a concerning increase in the number of cases among our first responders and other healthcare providers, and we're trying to give quick and timely guidance so that services aren't disrupted. We've been very fortunate today to be able to work with the hospital to secure some resources that are badly needed. I'm sure that they will talk about later. I couldn't agree more with Michael. We have the opportunity to make a big difference by doing the right things. I would encourage everybody to follow those basic things we've talked about: social distancing, wearing face coverings. Thank you.
Good afternoon, everybody. I'm Sheriff Matthew Wade. As we go through this pandemic, and we have been doing so rather well at the county jail up until today, last week, the Monday before the election, we had some reserve deputies who went to Florida to retrieve an inmate from a Florida prison to bring them back to our jail to face charges. Later in the week, those reserve deputies became ill. We discovered that they were positive on Friday. We pulled the inmate on Friday, had him tested, and now we have our first confirmed positive of COVID-19 in the Calhoun County Jail. So that inmate's been quarantined. The inmates that he's been around for the last 5 days, we're working with ADPH and our medical staff to have each one of those inmates tested, and also any officers that were exposed to him as well, which would be the majority of the officers. With that being said, we've done a really good job up in this point to be on July the 20th and just now having our first COVID-19 patient in our jail. While we have dodged that bullet till this day, we knew it was inevitable. It's a virus. We know that it's going to get in with some shape, form, or fashion with hundreds of people coming and going every month. We have had a total of 4 deputies that's had COVID-19 to date that we know of. We have a couple that's being quarantined and being tested to date. So we are fighting that battle of staffing. We are fighting that battle of trying to keep our people well, and also the citizens that we come in contact with well, as said. So if anybody has any questions about the jail, please encourage to call my office. We'd like to make sure we post the facts and not just rumors. But we've had 1 inmate test positive. He was tested Friday. That inmate's quarantined. We're going to test approximately 32 more that were in a section with him, and we'll find out those results in the next week or so. Thank you.
How many deputies do you have out of rotation right now because of COVID-19 concerns?
About 4.
4, okay.
We have about 4, which for us, a patrol shift would be 4 to 6 people. So, you know,
Almost
4 doesn't sound big until you say that 6 people is a complete shift. So we haven't got to where we can't provide our daily normal functions, but we're trying our best to make sure that we do that, take care of our people, make sure that anybody that's ill gets quarantined, gets tested, try to stop the spread of it any way we can.
Thank you.
One other thing I would like to touch on that I about forgot is, you know, with the order of the mask, that has created a good bit of controversy, has created a lot of people that have called the sheriff's office wanting us to investigate churches and tattling on people, I would say, for wearing or not wearing a mask. And I would say everybody needs to wear a mask. Everybody needs to be considerate of others. Take care of yourself. It's part of your own personal responsibility. And we also need to not forget how to be kind to each other during this trying time of people trying to go through life, make these adjustments. It's just not easy for anybody, so it never hurts to remember to be kind to your neighbor. Thank you.
Hello, I'm Chris Collins with the Anston Fire Department. As Michael said a minute ago, we've reached a benchmark that we as a body of leaders has been concerned about from the very beginning. We've reached a benchmark where the hospital is starting to see, our local healthcare specifically, seeing capacity numbers which were limited to who we can take in, who we can treat. That's been a concern from the beginning. When we look at the concern, when we look at what we can do, the measures that we've been sharing with all the public for quite some time now, those are the only recommendations that we currently have. That's the only way we know to fight this virus. We know that it's a very divisive, a very unique situation. Some people are using political platforms, some people are using social media. But what I would encourage the public to understand and know are the facts that are going to be shared with you here today, because this affects everyone, whether directly or indirectly, based on what the healthcare can do locally. The only recommendations that we can give you are to follow the measures that we've given out. Wear the face coverings, make sure we maintain social distancing, not touching our face, not washing our hands, looking at that, the groups, making sure we're keeping the social distancing at all times. That's how we can fight this and limit this. That's the only way that we know of that we can limit reaching that ultimate capacity number that we have here at the hospital, which I know a lot of people are focusing on just the virus itself and on what that capacity is, but what everyone in the public needs to understand, that it's a domino effect, that when we reach that capacity, it affects the hospital's ability on all advanced life support care situations. And that's something that could affect you, your loved one. For example, if you were to have a wreck today, there's a lot of wrecks that we run in the city of Anston that all of our departments in the county run. We may have to transport you and you need some advanced life support care. If the hospital's limited due to the virus, then we're going to have to divert you somewhere else, wherever that may be, based on the situation at hand. So what we recommend, what we ask, is that you don't look at what's going on in other cities necessarily, other states, other nations for that matter. Don't focus just on what you see on Facebook. Listen to the facts that are going to be shared with you today. These are what affect you personally. And we're the only ones, our citizens, our communities, we're the only ones, by taking these measures and limiting the spread, it doesn't eradicate this disease, it limits the spread. We're the ones who can do that, and that's what we're encouraging everyone to do. We have partnered with, of course, the EMA, the Anniston Fire Department, Anniston Police Department's partnered with EMA, partnered with ADPH and RMC. We're going to have another testing site on Thursday. We'll start testing at Harvest Church of God on Golden Springs Road. We'll start at 7 o'clock, and our goal is to make it to 11. From 7 to 11, we'll be having that drive-through testing. So if you're not sure, you have symptoms, this will be a place that you can come and get that free testing going forward. We ask again, please follow the recommendations. You guys are the only ones that can limit the spread of this virus. Thank you.
Good afternoon. My name is Louis Bass. I'm the CEO of Rmc Health System. To echo what you've heard from from our other speakers, to tell you where RMC is at today, 2 weeks ago we had 5 COVID positive patients on our COVID-1 unit. None of those patients were on vents. I kind of hate to give the numbers out because they change so rapidly that usually once I give them, they tell me I'm off. But currently we have 44. So in 2 weeks we've gone from 5 to 44. 9 of those patients, to my knowledge, are vented. 10 of those patients are ICU level patients at this time. We have opened, or in the process today of opening, our 3rd COVID unit. The first 2 units are now full, and so we're opening up our COVID-3 unit, which will allow us to take, we feel will allow us to take an additional 14 to 16 patients. That unit's in the process of being open. To echo what Chief Collins said, one of the big issues with this is that as we grow and our census, COVID census grows, it does require us to pull nursing staff from other units within the hospital in order to service the COVID positive patients. So as that occurs, it stretches our ability both in the ICU and on our med-surg units. We are in the process of moving and working closely with our sister hospital, Stringfellow Memorial, to move patients there. They do have some capacity, and we're moving patients to that facility at this time. I was very pleased, as Chief Collins said, I can't stress enough the wearing of the mask. Very pleased to hear last Wednesday that the governor implemented a statewide masking order. It is one of the only things that we have in place right now to help to prevent the spread of this virus. So I encourage all of you to continue to do that, to wear the mask, separate, and sanitize frequently. We need your help. We are stretched right now. We're dealing with the problems and the issues, and we'll continue to excel and perform in handling them, but we need the help of the community. We need you to understand this is a very real issue. And so we appreciate all the help that they can give us.
Good afternoon. My name is Joe Weaver. I'm the CEO at Stringfellow Memorial Hospital. And to this point, our facility has, as a sister facility, has played primarily a support role for the main campus. As you all are aware, the formalized COVID units do exist here at the main campus, but we have supported the hospital in terms of supplies, personnel, etc. But what we are finding is that even though we function in a support role, Stringfellow Memorial Hospital is becoming more and more affected by this as well. And that comes by way of patients who are now showing up in our ER who are testing positive, whereas in the past we were fortunate in that we did not see a whole lot of that. But the other real issue has to be that of staffing. As we've progressed through this particular virus, what we're finding is that our staff at Stringfellow is becoming more and more affected. We have several people who are out right now. We also have several folks who have begun to display symptoms who are in the process of being tested. As our staff at Stringfellow dwindles, so does our support for the main campus. So we are encouraging everyone to make sure that you wear your mask and you adhere to all of the standards and guidelines that you possibly can. The other thing that we have had to implement, as you well know, is a restriction on our visitor policy. That's one thing that we certainly hate to have happen, But in light of where we are right now, we have found that we have absolutely no choice but to do that. We apologize for it, but that's yet another way of being able to slow the spread of this virus. There are many people in this community who have loved ones here, and I know that they want to come in and see them. The problem, though, is that every time that happens, there's a possibility that we are furthering the spread of this virus. So again, we would encourage you to make sure that you take every precaution that you possibly can. We know it's restrictive, but at the same time, there's nothing else that we can do at this point in time. So please make sure that you do that as much as you possibly can. This is a great community, and we certainly want to make sure that we can do everything that we possibly can to make sure that it doesn't turn into a hot spot. But that's not just up to the folks here at the hospital. Everyone in the community has to play a role in this. And if we're going to get through it, and we'll have to get through it together, everyone is going to have to do their fair share. So please make sure they understand that. Thank you.
Good afternoon. I'm Dr. Free. I'm Chief of Staff at RMC and a hospitalist. I want to thank everybody for being diligent, helping us in the community as well as in the hospital. I can't tell you enough. If Michael said that there are 400 positive cases, we have 44 patients here. That's 10% or more. Luckily, we're going to discharge 2 today, hopefully. But as we discharge, we get more. 1/2 hour before I came down here, I got an admission for another positive COVID patient that is appropriate for hospitalization. When we hospitalize these patients, there are other conditions that the patients have. They may have heart disease. They may have hip fractures. They may have other things that require us to take care of them as patients. This is not, this is something we do all the time. The COVID positiveness, the condition that causes pneumonia, the respiratory distress, the respiratory failure, the cytokine storms, which causes inflammation and sometimes multi-organ system failure, those are the fearful things that we have to treat. Please, I can't stress to you enough, be careful. Wear your mask. Do not go out in public places without your mask. If you have to go somewhere, wear your mask. Do not go to the beach. Don't go out and do vacationary things at this present time because you have a possibility of getting sick. Now, there are positive COVID patients or people that don't require hospitalization. Please be careful and quarantine yourself. Please be mindful of other people around you. Here at the hospital, we have now 8 patients that are on a ventilator. We were able to extubate 1, but as we extubate, we intubate. As we discharge, we admit. We admit, then we discharge. We're working very diligently with all of the doctors, every single one, to help us get patients in, treat them appropriately as it's time for discharge to discharge. Our nursing capability, as everybody's been stating, is very stressed. If there are any nurses in the community that are retired or have been furloughed or have worked in New York or any of the other hotspots, we need you. We need you badly. We need every man, every hand on deck, everybody that can be helpful. The treatments that we have for moderate to severe, we have a protocol that we're following, and also for severe patients. We're in line with what's going on with the rest of the country. So we've got an infectious disease doctor, Dr. Magadia, that's working very, very diligently. He's keeping up with research. We have pulmonology critical care specialists. We have nurse practitioners that are working. As Lewis said, we have 3 COVID units. We've superseded 2. We're going to the 3rd one. Everybody's pitching in, but we're having to pool the resources of nurses that are already stressed. Please be careful. Please help us so that we can keep this community thriving, so that we don't have to shut down like we have in the past. If we don't, if the country does not, that's going to happen. And we saw what disastrous financial, emotional, psychologically poor resistance and problems that occurred with that. So please help us. Again, we appreciate the community for coming in, helping us, bringing food, supporting us. Support us in the best way by wearing masks. Keep yourself self-distance, wash your hands. Be mindful of people that are in your home or community that are sick. You don't want to take that back home because you're having a good time at a beach. Please be careful. We love this community. We need you. You guys need us. We are able to treat patients. The wait in the ER may be a bit longer because we've got these patients that we've got to treat, and we've got critical care more than we've ever had in the past. Our ICU normally is now on critical diversion. We are even having a hard time admitting people. So what we would typically admit, we're treating in the ER. We're treating in the ambulatory care centers. So stay healthy as best you can. If you can stay healthy, you don't have to come into the hospital. Please. Thank you.
My name is Jack Draper, Mayor of the City of Anniston, and I would just like to let everyone in Anniston know, and those all throughout the county, that your local governments are working very closely together. And we've been working very closely together since the end of February. Those partnerships with the governments, with our healthcare providers, our professionals and workers, have borne great fruit. I mean, it's helped with the securing of PPE, and it's helped with standing up testing sites and continuing to stand up those testing sites, and it is important that we continue to work together as we have. Your governments are working, but we all have a part to play in this. We've got to follow the governor's orders. We've got to listen to our healthcare professionals. Wear a mask, maintain proper social distancing, maintain good hygiene. We are all in this together, and we all have a part to play. Thank you.
Thank you, Mayor. In response today, as well as Friday night, as we anticipated the capacity increasing to help our healthcare partners at the hospital, the Unified Command of Calhoun County has made a number of requests to the state through the Alabama Incident Management System that the Alabama Department of Public Health maintains. We have requested, as Dr. Free mentioned, the need for staffing for nurses. That request has gone out to the Healthcare Coalition for this district. It is also going out to the Medical Reserve Corps for Calhoun and Cleburne counties. And we are in the process of petitioning the Governor's Office of Volunteer Services for additional staffing that could come from other places statewide. If adequate staff is not able to be brought in through those means, we're preparing with the Alabama Emergency Management Agency as well as the Alabama Department of Public Health to make the request for federal resources through the Federal Emergency Management Agency. In addition to staffing, there's some vital equipment that's needed, and we want to make sure that while we have it in supply at the moment, we know that we're getting very close to that capacity point with ventilators. And so, as Mary mentioned a few minutes ago at the beginning of the press conference, we've been able to procure with their assistance some additional equipment today as well that has gone directly to the hospital to be able to assist directly in patient care. So those efforts are going to be ongoing. The Unified Command stands ready to continue to work to facilitate and connect those resources with the needs. So at this time, we'll open it up. Any of our leaders here today that have spoken will be available for questions. So we'll take questions both from the media that's present as well as from our Facebook Live audience today.
Could you repeat the question before you answer it?
I will. Thank you.
How many first responders have been infected?
How many first responders have been infected is the question. I know of, you could easily say probably over the course of time, probably 24 that have been infected. Most of those have recovered at this time. I'm aware of 12 right now that are isolated and are being tested and or are positive right now in the community.
I have a question for somebody from RMC. What procedures do y'all take if a staff member is exposed to COVID-19? Do y'all wait for symptoms to appear, or do y'all have them tested immediately?
If a staff member has symptoms, we will get them tested. We do have the ability to do a occupational walkthrough type drive-through at 2 o'clock every afternoon. So if a person is symptomatic, they're able to do that. For doctors that may be symptomatic, they can go to the emergency room after calling Dr. Magadia. They have to register like everybody else, and they can be seen that way.
If you guys just opened a third COVID-19 ward to accommodate 14 to 16 additional patients, would that put you at capacity if you received that many more patients at this time?
Louis or Dr. Free?
The question was if we open when we open COVID 3, and the amount of patients is from 14 to 16, and we have 42 patients in the other COVID units, will that place us at capacity? It will, but we're willing to open more beds. I think there's a 30-bed capacity on 5. We have other areas that we will open if we have to. We will look at the procedural areas, talk about elective surgery procedures, and see if we have to make some changes there. So we have a plan, yes.
Thank you. Can you address schools and how our children will remain safe when schools reopen?
So the Unified Command, as we've talked about before, is working with our school superintendents throughout Calhoun County. We have a working group that is looking at the school issue and helping the superintendents provide resources from our subject matter, some that you've heard from today, others that have been on our team from the very beginning. There's national guidance, there's state guidance, but we also believe it's important to have those local stakeholders involved. So all that's in motion, all that's being done. At the end of the day, the individual boards of education have to make those decisions. But I believe that from our involvement through the Unified Command, the school systems, along with our subject matter experts, are doing everything within their ability to make sure school is going to reopen in a safe way for our students, for our faculty, and for our staff, and the community as a whole.
I have a hospital question. Why are nurses being laid off if RMC is needing nurses?
So I believe I addressed that one about 3 months ago, but let me make it very clear. There has been no nurses laid off. There has been no nurses ever laid off. There has been no nurses terminated. Again, as I addressed 3 months ago, we follow our normal staffing practices, and that's when volumes go down, we flex our staff down. When volumes go up, we flex our staff up. So we have called back all the nurses that we have available. We're in the process of contacting even more of those. Some folks have made the decisions to go to hot spots such as Atlanta, to New York, Birmingham, other areas because of opportunities there to make better wages, higher wages, and take advantage of that. But again, I don't know how many times I can say it, but RMC has not laid off a single nurse nor terminated a single nurse.
Have y'all furloughed?
We've not furloughed. Well, when I say that, if volumes have dropped, like during the early part of this, when volumes were dropped, they were given opportunities if their units were very low to take advantage of that. I don't know how many did that. I would say it was very, very few, and most of those would have been in non-patient care areas. So, but they were, just as others, they were given that opportunity when the volumes were extremely low. But that has not been the case, to my knowledge, in at least the last 2 months. Okay.
What about parents and grandparents who are high risk that will need to send their children to school and may risk bringing the virus home to them?
So I think another school question about parents and grandparents. Again, for specific school questions, I think you need to contact your local school system. At the same time, that's a decision that most of the school systems, I believe, have provided flexibility for. That if you have a family member who may be a higher risk category, there are virtual online options available. But contact your individual school system to get the most up-to-date information on that and to make the best decision for you and your family.
Is there an area in the community that can help with those who may need to be tested for COVID that don't have insurance?
So there are a number of resources available, I think, for folks who don't have insurance to be tested. ADPH runs a couple different options. Mary, do you want to speak to those in Calhoun County and the hours and the availability?
Okay. We're running a health department clinic on Monday, Tuesday, and Wednesday from 8:30 to 10:30, and we are looking at adding some additional days to try to meet that need. But those clinics would cover anyone who does not have insurance, or if somebody does not have a regularly assigned physician, one of our in-house physicians will become their doctor during this period of time. Thank you.
This is another one for the RMC officials.
Let me follow up on that one about folks that are uninsured. So if there are people that are wanting to help and provide resources in that area, you can contact the local United Way. They're very involved in supporting those different efforts for folks that may be uninsured or have need in the community. And so if there are resources that are available that you'd like to offer, contact our local United Way, and they'll be able to connect those resources with the needs in the community. So, hospital question?
Yes,
Next.
it's a hospital question.
Okay.
Have there been any major outbreaks, especially within testing labs, among other employees, and are staff given any kind of hazard pay for working directly with the virus?
Outbreaks. As far as the first one goes, yes, we have had some employees that have tested positive. I don't know, I would use the word outbreaks, major outbreaks, but we have had some employees that have tested positive in various areas of the hospital. And as far as hazard pay, no, RMC doesn't pay hazard pay.
All right, any final questions?
You guys have all made the same kind of statement in asking people to take it upon themselves to act responsibly. When you guys are out and about in the community, are you seeing people act responsibly in wearing masks and social distancing, and how businesses are handling it?
So I think, I've tried to limit my involvement out in the community because, again, the governor's order says safer at home. But there are those times that we all have to go out. We have our jobs to do. We have to provide for our families. We have to shop and groceries, those kinds of things that have to be done. Prior to the governor's order, it's about half and half the folks that are out there that are complying. After the governor's order, I've not been out much in the last few days, but our involvement with the Unified Command directly with our businesses and industries in this county, they've taken it very serious. The businesses have great measures in place. The industry, we've toured many of those. They have great measures in place for social distancing, for masking. They've worked very well, many of them, with RMC's occupational health group to take on the best practices for what that means in their industry and in their business. And so I think they've taken it serious, and I think that's the right thing to do because it helps to keep them open. It helps to keep our community safe, and we're moving and thriving in the right direction at that point. Any final questions?
Yes. How many ventilators are available for the county? And do we know if there are any major hotspots?
Okay. So, Lewis, I'll let you take the first part of that question. How many ventilators are available? 40? Okay. So 40 ventilators available in-house right now. And as I mentioned a few minutes ago, we have looked out to state resources with ADPH to secure additional ones if they are needed at that time. And I think, Lewis, you said only 9 are in use right now. 9 patients are vented at this time. 8 patients are vented at this time. The second thing is hotspots. So we are trying to look at some hotspots in the county. With ADPH maintains the database for all that information. So Mary has been trying to help us look at those areas. And our community test site in Welborn, a week before last, it was in response to a hotspot in that community. And so we're continuing to look at those and identify what those are. Obviously, our more populated areas, Anniston, Oxford, Jacksonville, there are more cases in those areas because there is greater population. So we're trying to drill down below that data at what really is a hot spot equivalent to what the population of the community is as well. Any final questions? Very good. Thank you for your time today. Thank you for tuning in today. As always, we encourage you to keep up with the latest information of COVID in Calhoun County through a number of resources. You can get us on social media platforms at Facebook, Twitter, and Instagram, as well as on the web at calhounema.org. And if we can help and you need to call us, feel free to do so at 256-435-0540. Thank you.